Coronavirus. Dozens of children develop a rare disease syndrome. Dozens of children in Britain and the United States have a rare inflammatory disease related to the coronavirus. This disease causes serious complications in a small number of children, some of whom require intensive care. About 100 children have contracted this disease so far in Britain, and studies indicate that the same disease has affected children in a number of other European countries. It is likely that the cause of this disease is a late immune response to infection with the coronavirus, which is very similar to Kawasaki disease. In April, the doctors who worked in the health insurance system were informed of the need to be careful and alert to the possibility of rare, but serious, cases in children. That warning came after 8 children fell ill in London, including a 14-year-old who later died. All the infected children showed similar symptoms when they were admitted to Evelina London Children's Hospital, including high fever, rash, red eyes, swelling and pain covering the entire body. Most of the hospitalized children did not suffer from serious lungs or respiratory problems, although 7 of them underwent artificial respiration to overcome any potential problems in the circulatory and respiratory system. Doctors describe this disease as a new phenomenon, very similar to the trauma syndrome associated with Kawasaki disease, a rare condition that mainly affects children under the age of 5. Symptoms of this syndrome include swollen glands in the neck, stiffness, and broken lips. But the new syndrome now affects older children, up to the age of 16, and a small number of them have serious complications. Dr. Lise Whitaker, a lecturer in infectious and immunological diseases of children at Imperial College in London, said that the fact that this syndrome is spreading amid the spread of the corona epidemic indicates that there is a relationship between the two cases. The prevalence of COVID disease reached its peak, and after 3 or 4 weeks we started to see a rise in the number of infections with this new phenomenon, which leads us to conclude that it is a phenomenon that occurs after infection with the virus, she said. This means that they are more likely to be linked to increased antibody in the body after infection with the virus. Very rare. Most of the children who were afflicted with this condition responded to treatment while they were recovering and started returning to their homes, said Professor Russell Weiner, president of the Royal College of Pediatrics and Health. He said that this syndrome is very rare. We should not prevent parents from allowing their children to exit from a state of closure, Professor Weiner added. He said that going into depth with the study of this inflammatory phenomenon may explain the underlying cause of the risk for some children of COVID-19, while the vast majority of them do not suffer from any symptoms or effects. It is believed that children make up only 1 to 2% of all new cases of coronavirus, and fewer than 500 have been hospitalized. Michael Levin, professor of pediatrics and international child health at the University of Imperial, said that most of the tests done on children showed negative results, but antibody tests showed positive results. Therefore, we believe that the biological mechanism of this disease is linked in some way to an abnormal immune response to the virus, he said. But he said, there is a lot we have to learn about this condition that was unknown 2 or 3 weeks ago. It seems that children with this phenomenon begin to suffer from it after weeks, up to 6 weeks, after being infected with the virus, which explains the reason for its emergence after several weeks of infection cases in the community peak. What is the situation in other countries? Similar cases have occurred in the United States, Spain, Italy, France and the Netherlands. New York State Governor Andrew Cuomo says that at least 15 U.S. states are studying this rare case. Of the 82 cases diagnosed with this inflammatory syndrome in New York, results from virus or antibody tests were positive in 53 of them. Epidemic control centers in the United States are about to issue a new warning and definition of the syndrome to health workers this week. Meanwhile, a study by northern Italian doctors said 10 children had contracted the disease there. The 10 children were admitted to the hospital in Bergamo, the epicenter of the corona epidemic in Italy between mid-February and mid-April, and they all recovered. These children, who averaged 7 years old, often had severe symptoms such as heart complications and toxic shock syndrome. Their treatment included giving them steroids, cortisone and its derivatives. And antibody tests conducted for the 10 children revealed that 8 of them had been infected with the emerging coronavirus, while the results of the other 2 children were negative. But researchers say that these tests were not 100% accurate. It is not believed that tests of the nasal scans of the virus are of benefit because the syndrome occurs several weeks after the time of the virus. Although this phenomenon is so rare, our study shows new evidence about how the virus may affect children, said Dr. Lucio Verdoni, author of the study and doctor at the 23rd Pope Giovanni Hospital in Bergamo. And child health experts in Britain say it is not necessary that this phenomenon affects exclusively children. They are currently collaborating with researchers in the United States and a number of European countries to understand more about this phenomenon, which has been termed PIDM, or PIMSTS.